I'm Dr. Nathan Stahl. I'm a geriatrician, and I am a PhD student working at the Women's College Research Institute. I'm supervised by Dr. Paula Rochon, who holds the RTO chair. Clinically, I'm a geriatrician. I look after older adults who are admitted to hospital or that I see in the clinic. But my other interest is in aging research, and that's what I actually spend most of my time right now doing. So I'm training to become a clinician scientist who practices both care of the older adults and who researches older adults, and particularly older adults in the healthcare system. I became interested in caring for older adults clinically early on in my training. I was interested in a few things that motivated me to enter the field of geriatric medicine. One of them was that I wanted to participate in a field that involved a lot of internal medicine. The second thing was that I was interested in participating in a field that involved neurology and psychiatry. And the third thing, which was the most important for me, was I was interested in looking after older adults. So I've always had a sort of affinity for older adults. I was very close with my grandparents growing up and still am close. And I also wanted to look after a population that I would consider is somewhat marginalized despite being such a prevalent part of the population. So there's a significant shortage of geriatricians, and I would argue we need to do a lot more to support older adults in the healthcare system. I became to realize also that one of the best ways to perhaps optimize care for older adults might be to become involved in research. So to conduct research that really shows what the deficiencies are in the healthcare system for older adults and how we can best optimize the healthcare system. So my PhD work, I'm doing a PhD in clinical epidemiology. So I'm looking at really population health for older adults in the healthcare system. And my PhD specifically focuses on caregiving for dementia. So I just actually returned from the 38th annual scientific meeting of the Canadian Geriatric Society in Montreal. And I was presenting work we did on what's called a systematic review. So a systematic review attempts to collate in a really specific and scientific way all the available literature that exists. And my focus of the systematic review was I was looking at stress related to caregiving for dementia, and I was looking at what the impact is of this stress on persons with dementia themselves. So we know that caregiving for dementia is one of the most stressful caregiving tasks that exists. And we know that caregivers themselves, when they do care for persons with dementia, there's a significant impact on their health, there's a significant impact on them psychologically, and often there's a significant impact on them socially and financially. What's less known before our work is what the impact is of having a distressed caregiver on the person with dementia themselves. What we found in our study was that there is a small but significant body of literature on this topic. We collated data on 81 studies that were published over an over 30-year period from across the world. We included nearly 50,000 participants, so these were both persons with dementia and their caregivers. And we found that when a caregiver is distressed, three major things happen to a person with dementia. They're one, more likely to enter a nursing home. They're two, more likely to experience elder abuse. And the third thing is that they're more likely to have worsening of their behavioral and psychological symptoms of dementia. So behavioral and psychological symptoms of dementia are complications that relate to dementia. So dementia, as commonly known, people experience cognitive impairment that impacts the way they live their life. But they also, unfortunately, as the disease progresses, do experience these behavioral disturbances and these psychological disturbances. And so the third thing, in addition to elder abuse and entering a nursing home, is that we found that these individuals are more likely to have worsening of these behavioral and psychological symptoms of dementia. So in addition to presenting this work at the conference, our systematic review is currently in peer review at a major scientific journal for geriatric medicine. And the larger plan for this work is to actually use this as a launching point for my PhD thesis work. So my thesis work is focusing also on caregiving for dementia, but I'd like to, what we found in the systematic review is that a lot of the work is done on a smaller scale, so very small sample sizes, And I want to really look at what the population impact is here in Ontario, actually, of caregiving for dementia. And specifically, what the impact is of having distressed caregivers. So we're going to look at this relationship of what's the impact on the person with dementia on a population level, and what the impact is also on the caregiver for dementia. I think this work is actually is critically important, particularly in 2018. There's a lot of emerging talk from people with dementia that I see clinically, from their caregivers, but also on a government policy level about how can we better support caregivers. A lot of the talk centers around the impact on the caregiver, which is very important. But also what I hope to add to the conversation is supporting caregivers is actually what's best for the patient or the person with dementia themselves. And so by demonstrating the impact of caregiver stress related to dementia on a population level, I hope that the work I could do can really optimize the healthcare system and improve the healthcare system for caregivers. You know, caregivers are really the unsung heroes of dementia care, but really of a lot of care. But from my perspective of dementia care, they provide thousands of hours of unpaid work for their loved ones or their family members who suffer from dementia. And we really need to do a better job of supporting these individuals, and that's what I hope to do, or that's what I hope to contribute to with my research work.